A very good evening once again, and welcome to our second edition of News Tonight. We'll start with a look at the big stories in the bulletin. Yes, in our big stories tonight, government to give relief cash to vulnerable families. Religious leaders want to be considered essential workers. Lockdown leaves passenger vehicles superfluous. While a Ugandan Olympiad tests positive to COVID-19 on arrival to Japan. It's News Tonight. Welcome aboard. My name is Michael Lokoma. Muhammad Mugalu joins in for sign language interpretation. Office of the Prime Minister has created committees that will oversee the enforcement of the numerous lockdown guidelines recently issued by President Yoweri Museveni. The Prime Minister, Right Honorable Robin Nabanja, says that the National COVID Task Force has also resolved to avail financial support to those persons most affected by the lockdown measures. Samuel Senono has it in detail.
The National COVID Task Force, chaired by the Prime Minister, Honorable Robin Nabanja, has created committees that will oversee adherence of lockdown measures issued recently.
The lockdown that we are undergoing right now is not a punishment. It's a last resort. We are struggling to survive as a country. And therefore, as the chair of this committee and the Prime Minister of Uganda, we have come up.
The task force sitting at the office of the Prime Minister in Kampala also approved the National COVID Relief Plan. The Prime Minister, Honorable Robin Nabanja, says government will offer financial support to the vulnerable groups greatly affected by the lockdown measures.
We are agreed to have direct payment method and the voucher system used for providing assistance to the vulnerable persons. This time, we shall not give food. We are saying people have phones, we shall use mobile money. Those who don't have mobile money, those who don't have phones, we shall use the voucher system.
She adds that funds have also been set aside to facilitate the frontline workers in the fight against the pandemic.
We directed the Minister of Health to utilize the 7 billion that has been earmarked by the Ministry of Finance, so that we can pay allowances for those health workers on the front line, so that we already had the allowances payment pending. There are those who have not been paid since January because of lack of money.
Ministry of Works and Transport has also been tasked to come up with special permits that will ease movement of essential workers.
And permissions issued in the first lockdown in 2020 are hereby revoked. There are those stickers that we used to have in 2020. So the police officers and all other security agencies, if you see somebody with the stickers of 2020, those are now void. Ministry of Works and Transport has been tasked to go ahead and develop an online application for movement permits. The details of this application and its operations are provided by the Ministry of Works.
Samuel Senono, UBC News.
The Archbishop of the Church of Uganda, Dr. Samuel Stephen Kazimba Mugalu, has asked those in charge to also include religious leaders among the category of essential workers. Dr. Kazimba also appeals to the country to maintain their spirituality in spite of the COVID-19 situation. This was during a Sunday service he held at his residence at Namirembe Hill.
The Archbishop of Church of Uganda, Dr. Samuel Stephen Kazimba Mugalu, wants government to consider religious leaders as essential workers.
People like us, we need, myself, I may be allowed. How about him? How about him? We are essential service providers. While other people are allowed to go in the market to sell the tomatoes, to sell the cabbages. The spiritual leaders should be allowed to go and minister to people. Yes. Where is the hope? People have no hope. They are killing themselves. And let us work together, the police, the people, let us listen to one another, let us talk to one another. Don't just find somebody walking and begin beating over. No, let's hear one another.
Kazimba also wants government to pay attention to the well-being of doctors and nurses who are on the front line of fighting COVID-19 so that they don't lose their lives in the process of saving others.
Abasawo nabo COVID abakwatira eri abamu abali ku bitanda bateekebwe engeri y'enjawulo kuba abali ku buweereza bwe butyo babeerewo engeri y'enjawulo omusawo aba alwadde akolebwako atya aleme kubeera mu bali bonna abalala kubanga abasawo bajja kutya okussa omwoyo ku balwadde nga bagamba naffe tulwala teri atufaako.
In the same instance, Church of Uganda has declared 3 days of praying and fasting for the situation pertaining in the country to normalize.
We declare these days for prayer, yes, for fasting, for seeking God's will. Yes. You can pray. This is the time you can use chain prayers. Yes. Like having the whole 24 hours, 30 minutes of Reverend Simon, like 30 minutes and then 30 minutes of Stephen Kazima, 30 minutes of Captain Titan, 30 minutes from everybody. You can have 30 minutes, about 20 people, 50 people pray.
Archbishop Kazimba also sent warm greetings to the all men making Father's Day.
This is the time for the fathers to offer leadership in our homes, to give guidance, to have your children, to talk to them, not just to fight them or beat them, guide them. This is the time. It has a challenge, but the advantage is to be with your family and talk to your children. This is the time.
Kazimba was delivering his homily to a few members of the church and the family at his residence located at Namineme Hill in Kampala. Deborah Namamonde, UBC News.
For many people who have survived COVID-19, the experience with the virus creates long-lasting trauma, even though they are the fortunate ones. Many have lost their lives to the deadly virus, but others have pushed through. UBC managed to talk to one of the survivors of COVID-19 to share their experience, and this is what they had to tell in a story.
Contracting the coronavirus can lead to social stigma. Symptoms can persist for weeks to months. For many people living through this, sharing their story is the only way validated. Here's what some of the survivors have to say and what you need to know. Dr. Sam Riamoki is a medical doctor turned trade unionist of over 20 years. The former Workers MP spent weeks battling COVID-19 at Mugalu National Referral Hospital, and now he gives his ordeal. He says that initially he thought he had malaria and started treatment, but the pain persisted.
At the beginning, I started treating as malaria because I didn't expect COVID really, because I had done all the scopes. But later on when they diagnosed, I didn't have doubt because I didn't realize at all these actually signs. And actually, I'd been falling sick of malaria, and also some few times I'd been addicted, but this is the first time I had the type of pain I was feeling. The body was so bad. To the extent that at one time I got disgusted with the body because they are giving painkillers, but the pain is not going. The fever is so much like the body is burning, not the fever I always get. Because the malaria fever, chills and stuff. But it's a fever which is like the body is burning. And then I realized that again, if I fry the body, I would die because you can't live in this house without a body. So
Riamoki narrates that as he was struggling for his life in the high dependence unit, one question kept on lingering in his mind.
The question, what happens when you die? That is the question. Every time you think of such a question, you don't try to dodge because you know that my death is far. There's always that depression. But now here I am, and there are 50-50 chances either of recovering or continuing. And I said, okay, if I die today, what happens? So now I was in that one, asking God to take over, and whatever happens, I handed everything to him. Then I realized that question is very simple if you are in the road.
Dr. Riamoki says that his experience at the hospital brought him closer to God and has changed his life and the way he looks at things.
Looking for a vessel, I'm just thanking God trying to sing, "Oh Lord my God, when I in awesome wonder consider all the works thy hands have made." Got that. Now, by the time I reached and almost crossed, but finally gave me a chance to continue living, I knew that the time I'm going to live, I should use it productively to conclude.
In the isolation room, he says that he felt so lonely, abandoned and driven into panic mode.
You know, you go to hospital with your family, because usually you go together. And then, when they discover that you have COVID, you are separated. Now, then starts, so that shows it gives a very big loneliness, because, okay, like for my, I'm separated now, I'm with the health workers, but the health workers are in PPE. And then, that separation from the family gives you another very big haunting, because you see, you start seeing, oh, it even makes you think that you are now, the death is near, because and then I say now, you remember colleagues who are fallen sick, you go there and bury and you come back, all of you, and leave them. So that's the feeling now. Oh, so it's like, I will never see this again. So it's like now, from here you're just going to be taken to bed. So
the COVID-19 survivor has no kind words for private hospitals that are charging exorbitant monies to manage COVID-19, but thank the management of Mugalu Hospital.
That private sector charging 3 million, for me, I'm sorry, they are my colleagues, but that's being acting as scavengers, because I don't think that the treatment, because I know the type of drugs we give, even oxygen, it cannot be worth the 3 million to people, really. That's too much per day. And I think the government should prevail over the private units. I know it's difficult to establish IC, whatever, but instead of scavenging over people are in need, because people are so desperate. Actually, in the private unit, I was supposed to pay 3 million per day. But here, when I look at this thing, if you compare the standard, this was almost, if not the private, I would even pay 20 million per day. So I come out of that place, and I'm not paying any money. Free. So it's like I saved over 100 million.
I appeal to the general public to strictly observe the standard operating procedures to avoid hospitalization, and to all those doubting that COVID-19 is not there, take him as an example.
You are in that pain and experience as a human being. You don't want anyone, even if you have someone maybe is here and whatever, you don't want that person to go there, because it's a tough thing. So you're trying that no one should go there, let people just prevent themselves. Because I got COVID, tested, proved, have been treated, and I've come out. So for me, that type of speculation should not be arise. People should know that for sure there's COVID.
COVID-19 can affect the lungs and the body's immune system, and can lead to stroke and psychosis. By this broadcast, let people know that COVID should not be feared, but we should take our stand as children of your children and believe in your healing. UBC.
A living testimony there of Dr. Liomoki, somebody we know very well, about how he went through COVID-19 with the story he shared with our reporter Zahra Abigaba. Moving on, his demise at the age of 97 will not erase the fact that Lusaka in Zambia was the unofficial center for African independence liberation struggles. This was made possible by Zambia's founding and liberation president, Kenneth Kaunda, thanks to his love for Africa, the continent. UPC party president Jimmy Akena is alive to the fact that Zambia was receptive and accommodative to his family while they lived in exile.
Does not have the capacity to strike back at the enemy, because the enemy has been prepared for the last 60, 70 years, South Africa, for the last 54 years, Rhodesia. What's more, centuries behind them coming from the Western countries, vested interests.
This was the extent of his love for Africa.
And unless you understand it in this way, you will be misled by the enemy.
A man who came to be known as the grandfather of African liberation struggles is now the late. But Kenneth Kaunda's spirit of patriotism, nationalism and Pan-Africanism lives on. Uganda People's Congress Party President Jimmy Akena is a living testimony to this, having lived with his family in Lusaka, Zambia as asylum seekers.
Much of the late 80s I was in Nairobi studying or working, but in the early 90s I went and took a permanent residency in Lusaka. But we were well catered for throughout the period, and even after the 91 elections, when Kenneth Kaunda was defeated and conceded, the Zambian government continued with what he had established.
This generosity was an extension of the love he shared with the rest of Africa, including Uganda, whose president then he had close ties.
Because of the nature of the friendship between him, my late father, the late Julius Nyerere, I literally grew up with them as uncles and as father figures where you could look at and appreciate some of the issues which they went through.
It is this love for the continent that made Lusaka the center for Southern African liberation. His non-violent nature of handling revolutions made him a darling of the continent, something which Jimmy Akena is aware of.
The lessons we get from the liberation struggles, which involved vast areas, powerful adversaries, it is important that we also tackle the problems we face today as Africans to see that we can create a greater or a better future for future generations of Africans.
His association with East African presidents, including Tanzania's Julius Nyerere and Uganda's Milton Obote, made the trio appear at official triplets. And that is how the Mulungushi Club was born, a cooperation between Zambia's United Independence Political Party, Tanzania's Chama cha Mapinduzi, and Uganda People's Congress. The cooperation was meant to share information on social, political, and economic transformation, whose objectives, Akena says, were achieved.
I can tell you that in the 90s and early 2000s, when I was looking for data on Uganda, I found that this material was readily available in the University of Zambia. So what would happen is that all important information, whether economic, would be shared across these countries and would be shared also within the institutions of the countries.
As of today, only Chama cha Mapinduzi of the United Republic of Tanzania has since maintained political power. But this, according to Jimmy Akena, is not to say the zeal is lost. This is why there is a lot for young people to learn from Kenneth Kaunda, who has been variously described as a father figure.
The start of these countries of ours did not come on a silver plate. It was worked for. There were nationalists who gave their all, others gave their lives. And in Southern Africa particularly, a lot of it was fought for.
Kenneth Kaunda ascended to political power in 1964 when the former Northern Rhodesia won independence from Britain, ruling for 27 years. He may have lost elections in 1991, a defeat he patriotically conceded. He may be dead at 97, but his legacy, seen in his love for Africa, is alive. Henry Okurut, UBC.
The Virus Research Institute Executive Director Professor Ponciano Kalebu has explained that individuals who are affected by COVID-19 may, despite being vaccinated. Kalebu also wants action taken against private health entrepreneurs handling COVID-19 patients without proper and accurate results to save the country's reputation.
In February to March, we begin to see some changes. Introduction of these new variants that had been described in the UK and in South Africa. In fact, when you look at our data, this is preliminary, we're still doing more. If you look at our data of February to March, we have now a dominance of the UK and the South African variants, which are the Alpha and the beta. And then the A23 is third. In fact, that time, February to March, the alpha and beta, the UK variant, South African variants, had the same percentages, yeah, on number one, and then the A23 was the second. So now we're beginning to see an increase of these new, what now they are calling variants of concern. Now, when you look at the data of April to May, now again you see now at the top is the variant from Nigeria. It used to be called the Nigerian, but that has changed. That one is also a variant of interest, not of concern, but has some interest mutations that are of concern. Then we have also the Indian as number 2, yeah, in April to May. So we have the Nigerian, now the Indian, and our A23.1 is third. So you can see a shift now into these variants of concern which people are worried about, and variants of interest. So we can say we are still looking, but we can see we are beginning to see a shift of a dominance of these variants that are thought to be more transmissible, yeah, and in some cases they could even cause more severe disease. So also as far as vaccines are concerned, the Delta is also less, there's less protection against some of the vaccines. But the good thing is that still the vaccines are good against severe disease, yeah, severe disease, and I think that's the most worrying. We're going to continue seeing, but elsewhere what they have seen, a lot of the breakthrough infections among people who have been vaccinated, most of the breakthrough infections, the Delta now is being, they point at the Delta. We are also going to watch it. We are going to do studies among, the best way you have to look among those who are vaccinated and unvaccinated, and you see what is happening. And we are starting those studies. So I think the Delta is the most worrying one, the one from India. For now, against severe disease, the AstraZeneca is okay, yeah. But we need to study more. But against severe disease and people going to hospital, even here we are seeing it, that those people who have had their 2 doses, yeah, you have less, they can get infected, but you have less of them going to hospitals, being hospitalized, yeah, but you can't get infected, yeah. In fact, the preliminary work we have done, it's still not in big numbers, but we are seeing the effect of vaccination. In some of our groups, we see those who didn't receive the vaccine, we have more in hospitals and severe disease. Those who got 1 disease, less, and one dose, less. Those who got 2 doses, you can see a protection against severe disease and go into hospitals. So this, it is still small numbers we have looked at, but this also, if you add it to what others are reporting, I think AstraZeneca is still good in preventing severe disease and hospitalization. However, it is less effective in terms of prevention against the Delta virus and against the South African virus.
Is Dr. Ponciano Kalebu, a specialist in virus management, and that is what he had to share with us. There is growing concern over increased infections in homes where over 90% of the positive people are not able to be accommodated at health centers and hospitals. One of the major current strategies and guidelines by the Ministry of Health is home-based care for asymptomatic COVID-19 patients. The rapid increase of deadly virus community and home is mainly attributed to lack of adhering to key standards of preventions. Public health risk communicator at the Ministry of Health, Richard Kabanda, says that guidelines on home management must be adhered to avoid community transmissions.
Someone is positive and you're living with that person, so even when they look healthy, even when they are symptomatic, or even when they have mild signs and symptoms, some bit of cough and some bit of flu, which is not really heavy, these people should keep themselves all the time with masks at home. because we are avoiding them being or exposing those who are not positive. And because they have been living with people, then the other worry for us is that because you know that COVID is spread mainly through droplets, the surfaces they touch, the utensils they use, the clothes they wear. So the most pressing issue here should be that if Richard Kabanda is sick, then let Richard Kabanda manage himself. During the 14 days of closely monitoring him, he should be able to wash his clothes or keep them in a safe custody. He should be able to wash his plates and cups at home or the utensils at home. And if possible, if there is space, it would have been better for him or her to be in a separate room. We are trying to avoid having a mix-up of people. And even though someone looks healthy, even though somebody is asymptomatic, but that person is actually infectious. And once the infection spreads across many people in the homestead, then chances are high that it will be difficult to manage. Routine cleaning of surfaces where these people who are found to be positive touch, and thoroughly cleaning them with soap. If possible, let them mix in jig in that water. Because what we are looking at is to ensure that if there is a virus that has actually maybe dropped on a particular surface, then the detergents should be able to get rid of that virus. People, what we have seen is that sometimes when one turns out to be positive, especially we know that at this point in time, many of the young people, a big number of the young people who are in schools, those who have been able to be tested have been found to be positive. It requires a lot of extra effort for parents to have discussions with these, because the other biggest worry for us is stigmatization. So there should be deliberate effort to identify somebody who can closely have discussions with this person who has been found to be positive. Because isolation is not something that is easy, or something that we should take for granted that it is easy to be done. So it's better for a family to identify somebody who is close, to always have discussions from a distance, for them to know the risk other people in the homestead have.
Dr. David Kabanda, an official from the Ministry of Health, highlighting more on how we can adhere to guidelines and keep ourselves safe from the deadly coronavirus. Thank you so much for watching. We take a very short break. On return, we'll have business news tonight and more.
In chess, the small one can become the big one. It's the same here. And here too. Watch every move. Record every number so you can plan better. No matter the size of your dream, tomorrow's success belongs to those who keep today's records clean. File your returns today.
Uganda Revenue Authority, developing Uganda together.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
If we get vaccinated now, observe social distancing, wear a mask properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
What does it mean to be closer together? It's taking the last bus home for a surprise visit. Closer together is strangers finding a connection. It's bringing home something much more than a box. It's the warmth of home, or the beginning of something new. There's magic in sharing the things that we love, because it's those things that bring us close together.
In efforts to improve quality assurance and Uganda's competitiveness as a tourist destination, Uganda Tourism Board is set to undertake a nationwide grading and classification exercise of hotel and accommodation facilities. As a member of the East African community, Uganda subscribes to the East African Grading and Classification Criteria, a system denoted by stars ranging from 1 to 5. The grading and classification exercise will be crowned by the awarding of star ratings to facilities found compliant to the EAC minimum standards. This is therefore a call to all accommodation and facility owners and managers to register and get licensed by UTB as a requirement and get ready for participation. For more information, visit www.utb.go.ug or email qualityassurance@utb.go.ug for details. Uganda Tourism Board, promoting tourism together.
Thank you so much for watching and welcome to UBC Business News tonight. It has been a calm and quiet atmosphere in downtown Kampala as most businesses are adapting to the 42 days COVID-19 scale-down guidelines issued by government recently. At a tour around the city and its environ, you realize that most passenger transport terminals had turned to cargo carrying and transportation.
During normal operations, Namaiba bus terminal is home to over 100 transporter passenger buses. But after the new COVID-19 national lockdown guidelines, the terminal now largely lies empty throughout the day.
Actually, the current state of Namaiba, there's no business at the moment, basing on to the situation in which we are. Indeed, COVID is there, it kills.
It is only cargo lorries that are moving to different destinations.
Basically, most of these cargo items you see which are coming in, most of them are vegetables, things like iris, things like onion, things like passion fruit. These are the items which are coming, but basically things which people used to get from the markets, they no longer bring them, because most of these chikubo, these arcades, these malls are already been closed. So at the moment the turnover of the luggages which are coming are basically they are zero.
This is one of the carrot sack which is being prepared to be packed very soon, and it will be loaded on this truck you are seeing here for departure to South Sudan. As usual, as government halted the means of transport, that is the public, many people have tried to turn around to ensure that they at least earn a living. And it is through this cargo transportation that many are hoping to at least get back home with a bread in their hands.
Another transport industry hit by the new COVID-19 scale-down guidelines is the border industry.
They are carrying sick, they are carrying these essential workers. As the president said, they are not carrying passengers. Many of them are just loitering, looking for luggages, and luggages are nowhere to be seen because we have few markets around.
And we are not licensed to carry luggages. We are only licensed to carry passengers.
With their operations only relegated to carrying cargo and sick passengers, many have opted to park their motorcycles, but with a section of outcries to government.
We have just received the money from Yoga. So we are requesting the government to officially come out and announce that they have forgiven us paying back and revolving that money, because we are in lockdown. We have no way that we are going to get the money to return.
The 42-day ban slapped on public transport and private cars has seen bicycles increasingly becoming an immediate transport option for some people.
Baluga tusibeke wakana yato obulwadde bakugambye boberanga ingolyawo wamu nga tutambudde mu kutambuza ku mubiri bakakukwata kate gofa bufi.
Generally, Kampala and its neighborhood is entirely calm, with a few spotted dwellers and vehicles. Robert Onyango, UBC News, Kampala.
The Bishop of Kasese Diocese, the Right Reverend Francis Aquinas Kibira Kambale, has asked politicians to utilize the office of the President in the campaign against poverty. He was launching the Kabatunda Widows Project for Nzururu widows whose husbands died during conflicts that took place in Kasese district years back. The scientific function was held at Kabatunda Primary School in Kasese district.
I still have 180 million.
The Bishop Diocese of Kasese, Right Reverend Francis Chibira Kambale, has asked politicians to utilize the office of the President in the campaign against poverty.
The money does not belong to FDC. The money does not belong to NUP. The money belongs to all of us Ugandans. Okay? Even if you are NUP, why can't you get money from the government to support your people, to develop your people?
He was launching Kabatunda Widows Project for Nzururu widows whose husbands died during conflicts that took place in Kasese district years back. The scientific function was held at Kabatunda Primary School in Kasese district.
The money we received from the President, so we have bought land for her of 2 million, and this is the agreement. And then she's going to receive other money to boost her little business of 200,000. She's going to receive also goat.
Chibira, who officially handed over land agreements, cement, iron sheets and goat to 55 widows, hailed President Museveni for responding positively to his call when he asked him to support widows in Kabatunda village.
Once again, I'd like to thank the President, President Yoweri Kaguta Museveni, for caring for his people and for listening to my plea for the suffering widows of this area. And our leaders, let us all cooperate. Let us all cooperate that we support the marginalized. We support the poor of the poorest. Don't wish that the goat should go to your family, but wish that the goat should go to the poorest widow.
Bishop Kabira has also vowed to go back to the beneficiaries for evaluation before he gives them balance equivalent to 108 million.
I would like that we become very organized so that when we do this project very well, then I could also approach our President that these people, especially the wives of the widows of the royal guards and other people who have come from prison.
The chairperson LC3 Chirabaho Kabatunda Town Council in Kasese District, Mr. Dominique Asaba Ndugu, hailed Bishop Diocese of Kasese for the initiative but reported that more widows are in Kasese and the entire Busongore North need help.
Actually, I'm happy to receive things from the government through the Bishop of Kasese, Right Reverend Aquinas Kibira Kambale.
Bishop said out of 170 million from the President's office, he has only given out 70 million and the remaining shall be given after evaluation. The coordinator of the organizing committee of the project, Nzuku Kwa Joseph, noted that supervision will be made to ensure that the support is put to its right use.
First of all, we know the homes of each and every widow that has received this support. We know the status of the house. We even quantified, for those who are for renovation, we even quantified together with them what is required.
Bishop Kabira was accompanied by Treasurer Diocese of Kasese Reverend Siesa Joseph, Parish Priest for Chitwamba Parish, Reverend Charles Kajeni, and Susi Richard.
200,000 for her small business as they requested.
Brazil surpassed 500,000 COVID-19 deaths after registering 2,301 more deaths from the fatal disease in the past 24 hours, the health ministry there said. This, with the national death toll reaching 500, Brazil has become the second country in the world to record more than 500,000 pandemic deaths after the United States of America. According to the ministry, a total of 82,288 new infections were detected during the 24 hours, raising the total case lead to 17,883,750. the world's third largest following the United States and India. The South American country, which is experiencing a new wave of infections with hospitals overwhelmed by patients, has a mortality rate of 238.3 deaths per 100,000 inhabitants, as said by the Ministry of Health. More than 86 million doses of COVID-19 vaccines have been administered nationwide, and over 24.1 million people have received 2 jabs, it added. Now, talking sport, the second edition of the commercialized swimming gala has witnessed match day 1 action at the British School of Uganda. It was a spirited performance from both teams in this league, has officially been named the Altona BSK Swimming League, as John Band Center tells it here.
After a 2-week break that allowed the teams in the Altona BSK Swimming League to rectify mistakes from the first edition, action between Colts and Talons finally returned. During the break, new swimmers were drafted, including the Colts duo of Ethan Kalungi and Divine Kalungi, while Talons added Alice Mwase. Hosted at British School of Kampala, the resumption with match day 1 of the second edition almost replicated Team Talon's form from the first edition. Contested in the butterfly format, the day ultimately belonged to Team Talons that accumulated 184 points to Colts 153. Excellence on the day was by Tala Kisauzi, whose exploits in the 25 meters butterfly earned her a new record of 14.9 seconds, which she reduced from 15.2. Participants continue to relish the competition, which is bringing together some of the best swimmers in Uganda.
I think these competitions are really helping us get better, to improve ourselves, to help us learn more about each other, and to also use more teamwork so that we can be ready for the nationals.
The league takes a break to adhere to the latest COVID-19 guidelines. John Barnes, Sentamo, reporting.
Global Sports Mentoring Program has continued its generosity with a donation of equipment to Chiwatle Boxing Club and Hardbody Kickboxing Club. The kit also included that for women, which Global Sports Mentoring Program is intent on interesting into sport, whose benefits scale the heights.
Combat sport in Uganda has grown by leaps and bounds with increased number of participants. These include more especially the youth, but also accommodating the elderly that do it mainly for physical exercise to curb disease. But despite the growth in numbers, a major Achilles heel to combat sports is lack of equipment. It's the reason why Global Sports Mentoring Program has decided to offer equipment at 2 combat sports clubs, Kiwatole Boxing Club and Hardbody Kickboxing Club.
We are trying to advance the women movement of sports, but in the same way we cannot live without men. So we try to boost sports, all types of sports within the slums. We have a project called the Slum Sports, and we do handle different sports like basketball, soccer and boxing. So we are giving out equipment to try and promote sports, and as well as teach them about how to prevent COVID, because we are in the middle of the pandemic.
So we aim to use sport in order to help empower them as well. So today we've handed out equipment, but also we've handed out washing soap, because we are in the midst of a pandemic, and it helps that we should be able to promote the standard operating procedures further, so that the sportsmen can remain safe. So hopefully more help can be extended to projects like this.
Global Sports Mentoring Program delivered a first-class equipment including gloves, pads and training boots worth millions of shillings. The recipients are confident that this will spur them to greatness in a country full of opportunities that can be harnessed via preparations enabled by proper kit.
We appreciate your Global Sports, sports monitoring, mentorship for the gloves, for the sanitizer, everything you've given us.
Global Sports Mentoring Program is an international leadership development project launched by the U.S. Department of State and uses a sport to advance gender equality by, importantly, empowering women through sport. John Barnes, Sentamo, reporting.
And now a member of Uganda's Olympics team has tested positive to COVID-19 on arrival in Japan ahead of the postponed Olympic Games that start on the 23rd of July. Uganda's first batch of athletes and officials to the Olympics arrived in Tokyo Narita Airport on Saturday and immediately took the mandatory COVID-19 test. Prior to departure, the team had undergone the mandatory 2 COVID-19 tests. Unfortunately, an unnamed member tested positive and was maintained in quarantine while the others headed to Izumisanu, where a pre-games camp awaited. Uganda's team was led by government official David Semakula Katende and included weightlifting coach Hakim Sempereza and 2 boxing coaches, Patrick Lihande and Medi Mulandi. The athletes were swimmers Atohaire Ambala, weightlifter Julius Sechitoleko and boxers Catherine Nanziri, Shadir Musaboji and David Kavuma Semuju. Uganda Olympic Committee President Donna Rukade has confirmed the positive test but maintains intent on safety and health of the team remains of their paramount priority. And that brings us to the end of all we had for you tonight. Thank you so much for watching. My name is Michael Jordan Lokoma with Mohamad Mugalu and the whole team. Wish you the best of the night. Let's see what the lockdown has for us, but let's keep safe and take seriously every kind of guidance given to us by the experts and the officials as we struggle to see that we keep safe from COVID-19. Enjoy the rest of the night. Bye-bye. Keep it UBC TV. Wish you the best of the week.
Yet another weather edition from Uganda National Meteorological Authority. I'm Sharon Nakajiri tonight. Now taking a look at the satellite image taken over Africa today, we can see that we have moist winds from the Indian Ocean that are blowing towards our country Uganda, coupled with the moist winds from the Kwong Forest. That's why tomorrow morning we are forecasting light rains along Lake Victoria and in the northern parts of the country apart from Kotido, Moroto and in the south where we are forecasting sunny intervals. These conditions are expected to prevail even even in the afternoon in the most parts of the country. Temperatures are expected to rise up to 28 degrees Celsius in Gulu, Kotido and the neighboring countries, apart from Kampala where we are forecasting 27 degrees Celsius. For Kabale Highlands, we are forecasting 21 degrees Celsius. For international weather forecast, it will be bright and sunny in Dubai, temperatures rising up to 42 degrees Celsius. New York, Moscow and Nairobi, we are forecasting sunny intervals. As for Hong Kong, we are forecasting cloudy conditions. Temperatures in Nairobi will rise up to 22 degrees Celsius. That nicely concludes our weather forecast today. Till tomorrow, have a great week ahead of you.